with is Kinixu Health Provider. And we invited the CFO, Kevin Nepper, to come introduce us to that service. But I drive by the facility twice a day, but the parking lot is full all the time. Kevin, come on up here. Kevin is the CFO of this organization. Welcome, Kevin.
I'm an accountant. I'm not a public speaker, and I don't want to follow Terry. I asked her if she would come up and give my speech, but she won't. I'll do the best.
Because I'm not an accountant.
Yeah, we're busy out there. So I thought I'd tell you a little bit about what Kinixu Health Services is, because I think a lot of people don't know. I'm trying not to say not too much. Bear with me. I'll do the best I can. Kinixu Health Services is a nonprofit FQHC. FQHC means Federally Qualified Health Center. And Kinixu began in Bonners Ferry in 2002, and over time has expanded to 3 clinics. The original location was Bonners, here in Sandpoint, out in Monterey, and then Priest River. All of our service providers work as employees under our business model, and as a nonprofit, we have no investors and no shareholders. So we view our stakeholders as our patients, our employees, and the community at large. We're quietly one of the larger medical providers in town, or in the 2 counties, and we employ about 90 people and serve just about 15,000 patients between the 3 clinics. Can you hear me okay? I say quietly because when I was approached about joining Kinixu in late 2011, I'd never heard of the clinic. I'm not surprised today that when I talk to people in the circles I move from, they still haven't heard of the clinic. So I want to tell you, as I said, a little bit about it and the services we provide. Kinixu's mission is to provide access to medical services to our communities regardless of one's ability to pay. And if someone needs or desires the services that we offer, they won't be refused based on financial considerations. Although a small percentage of our patients do have insurance coverage, the majority, nearly all of our patients, are either covered via Medicare, Medicaid, or quite simply uninsured. And as it pertains to uninsured patients, visit fees are adjusted on a sliding fee basis based on federal poverty guidelines. And so what that means is that a visit to the office can cost a patient as little as $35. In many cases, when the patient has no ability to pay even a nominal fee, we actually slide the fees off and the visits are free. To assist us in carrying out our mission of serving those in needs, we do receive a portion of our funding, a small portion of our funding from federal grants, which are available to FQHCs. And without that funding, we couldn't accomplish our mission. But even without the grant support, here's the fun thing I do. The nature of what we do makes cash management a continual and stressful point of emphasis, and making ends meet keeps me up at night. Yeah, somehow we're able to provide a wide range of services and do so with a quality effort. I think that's demonstrated by the fact that we're on the forefront of quality initiatives such as patient-centered medical home. We recently achieved level 3 recognition. If you understand what PCMH is, level 3 is pretty good at this point in time. Additionally, the majority of our providers are well along in demonstrating electronic health record meaningful use. I'll give you a quick summary of the services we provide. If that's slowed down, I can stretch it out. I used to be in a band out of high school and college, and I was comfortable on the stage, but I was a guitar player and didn't have to be on the mic. It's been a long time. That's not one of the services we provide. Although, I did play at the company picnic with Tom Lawrence. Has anybody ever seen Tom Lawrence play his bass at events? He pulls his hat down low and that guy pulls his bass. He says, slower. That's the whole night. Anyway, we offer primary care. That includes family medicine, pediatrics, and women's health. Next would be dental services. There's a huge demand for the dental services we offer, and our capacity is limited because we have 2 dentists. So we focus on pregnant women, children, and dental emergencies. When we do have additional capacity, We expanded to our veterans and patients with hypertension and diabetes. We've worked with the Angels over Sandpoint for a couple of years, and they've been generous and helpful in providing us grants, so we've been able to expand our veterans and at-risk services, which has been great. Next would be behavioral health services. We're actually pretty strong in this area, and we have 5 counselors, including a just hired psychiatric nurse practitioner. And besides the traditional counseling services, I'm proud of the fact that we provide direct support to the modern boundary public schools with in-school counseling services. And I was personally involved in piloting the initial project at Northside School where 4 of my kids attend. And I'm proud that we can do that. And it's important that we can do that to help bring support to our children. We also work in the senior mental health at the nursing homes and in-home visits. We're focusing right now on Alzheimer's and dementia. And we're just implementing a program. We received a small grant to do so. It's called SBIRT, and it's interesting. SBIRT stands for Short Brief Intervention and Referral to Treatment Program. And what we're doing is actually staffing a behavioral health provider on the primary care floor. And we're actually working alongside the primary care providers to work on issues like depression, addiction, and other combined medical behavioral health conditions. We're figuring out how to pay for that. So it's an interesting model. RCMO Tom Lawrence highly supports it. We've got to figure out how to make it sustainable. I'm interested in seeing how it develops. This year we implemented a 340B pharmacy program. It provides subsidized costs on some prescriptions for our patients. And we don't have our own pharmacy, so we have to establish relationships with local pharmacy providers. Well, basically what it does is it allows our patients to get the lowest available prescription costs. We provide free patient assistance in outreach and enrollment. This helps individuals, and I won't say patients because it doesn't matter if it makes patients or otherwise, to get qualified disability, Medicare, and Medicaid, and to help them understand what their insurance options might be under the Affordable Care Act and these changes. And lastly, something I'm also proud of is we're the outsourced provider for the VA. Our clinic currently sees over 1,500 veterans in the 2 counties. In the past, we've had to find a way to Spokane. One of the reasons we're provided is we have no marketing budget. This is our community outreach when you're here, right? So I think for the at-risk and the veterans in our community, where there's immediate services for them to get the word out is important. We certainly can have the capacity to see more vets love providing the services for them. So I want to say, moving away from services, that initially things got off to a bit of a rough start. And some of the strategies that we employed in the past caused harm to our relationships with local hospitals and private practices. And if you're involved in medicine in your town, you may know that we're viewed as a direct competitor for patients and medical dollars in a small town. That's not our intentions. And we're working hard to repair those relationships. And though we aren't seeking to directly compete with other providers, we'd rather be seen as a source of community support for those who are at risk and the poor and needy who wouldn't have steady and stable care if we weren't here. At the same time, we do need to create stability so the mission survives. And it's important for me to create a fun, meaningful, and stable work environment for our employees who are also our stakeholders. I think it's important we achieve it. And I also know, something that keeps me up at night, that the changes coming about in healthcare are placing huge amount of time and financial stress on medical providers. And personally, I think it's only going to get harder as the nation figures out the model that we will use to deliver and pay for health. I feel strongly that for our town, the hospital, the private practices, and us, the community health center, must find increased and better ways to collaborate and work together so that we can deliver a more sustainable medical services model for our town. And if we achieve that, I think we can utilize each of our strengths and unique aspects of care to our best advantages. I thank you for inviting me. I hope what I shared with you. So I guess I've got time for questions. Yes, sir.
Talk to us about the state exchange. When you're seeing people who aren't insured, does the state
Perhaps by definition it should have, but no. The rollout of the ACA actually created more financial stress for us. I'm sure Doctor will talk about it a little bit, but the ACA is a three-legged stool, and the exchanges were part of it, but Medicaid expansion is actually supposed to take care of the poorest of the poor. And if you're at 100% of the poverty level or below, you actually don't qualify for the exchanges. Many of our patients fit that. And so what it really did was create an incentive and an awareness that they should receive better care. And so they access care at Nixon more frequently, but they didn't have any other mechanism for us to pay for it. So it's actually been a harder year because of the ACA. I know that the governor is taking steps for whatever reason to expand Medicaid now, so we're hoping to get some with converting frequent users who are uninsured into Medicaid coverage. Mark?
And can you go back to what you were mentioning about veteran services? So, what do you, because I know a lot of vets who, you know, if they want to go to the VA hospital, just find a drive, does that mean that they can seek service from you guys? Okay.
We offer primary care services, so they don't have to go to Spokane for doctor's visits, if you will. And then recently we've actually established the ability to provide, and they control what we do. We're not a VA, but when we perform as an outsourced VA clinic, we're controlled as an arm of the VA. But through the agencies, we've actually been able to extend dental services, which the VA doesn't authorize us to do, so we pay for our bodies. And we did recently establish a contract with them, so we're actually able to provide behavioral health counseling too, which is something. So I would say all primary care, limited dental, and behavioral health is what's available for them. Thank you.
Thank you to Kevin and to Terry for insights into what's available in our community. And my name is Cheryl with DA Davidson in town here. And I'm pleased to introduce our third and final speaker. Dr. Scott Dunn, MD, is a family practice physician and partner with the Family Health Center of Sandpoint. And they're located in the Pine Grove building near the hospital, which is now part of Bonner General Health. Dr. Dunn has roots in this community, and his practice is on the cutting line, the front line of implementation of the Affordable Care Act, which is a major piece of legislation that's rolling out and impacting our economy and our healthcare services. So please welcome Dr. Scott Dunn.